Today, I'm pleased to introduce, along with the Improved Coordination of Mental Health Care for System-Involved Youth Act of 2019, with our Councilmembers Rehabilitation and Nadeau, Councilmember Bonds, Councilmember Grosso, Councilmember Cheh, and Councilmember Robert White. This bill seeks to improve the coordination of mental health care for the system-involved youth by requiring the DYRS, which is Department of Youth Rehabilitation Services, to establish a program to improve continuous services provided by committed youth. This legislation requires DYRS to develop individual support plans for committed youth related to behavior and mental health that go beyond what is currently provided. The plans must consider how services will be provided if the youth transitions from placement settings. The program must also work to strengthen the connections to community-based supports for youth who are placed in the community settings and for youth following the end of commitment out of the DYRS system. Incarcerated youth are denied access to their families and loved ones, faced with challenging education access and often exposed to trauma. Chairman, may I continue? Thank you. Often exposed to trauma and thank you, while detained. Conditions facing youth can hamper individual development and create lifelong negative consequences. Between 90 and 100% of young people enter the deepest end of the juvenile justice system have experienced complex trauma, including witnessing or experiencing violence at home and or in the community and school. Effective assessments and comprehensive response to court-involved juveniles with mental health needs can help break the cycle and produce healthier young people who are less likely to act out and commit crimes. Many juveniles who commit delinquent acts have a history of substance abuse and mental health. In the Department of Justice Arrestees Drug Abuse Monitoring Program, half of the male juveniles arrested in 9 separate sites tested positive for at least one drug. Studies have also shown that up to 2/3 of juveniles in the justice system with any mental health diagnosis had dual disorders, most often including substance abuse. While DYRS has made a significant improvement in the delivery of mental health care services, there is continued improvement needed in the coordination of care, particularly youth who are committed to community-based placements who are in the community still under their care. This measure will work towards closing these gaps so that young people connected to DYRS are able to effectively and efficiently receive the treatment that they need. I welcome any co-sponsors. Thank you.
Thank you, Councilmember White. Are there co-sponsors? Councilmember Gray? This bill will be referred to the Committee on Recreation and Youth Affairs with comments from the Committee on Health.